Hey man, how are you?
Hey, good. How are you, Nathan?
I'm doing great. I'm glad we could get some time here to talk about what's going on over at Versicode. I know it's been a real exciting few weeks, especially. And I think the focus right now being where are we in the space? What's going on in the world of HCC coding and kind of how is Versicode really positioning itself for success and bringing some new things to the market. From my perspective, it seems like it's a real exciting time. Just wanted to get your thoughts and maybe flesh out a little bit more of like where Versicode's at right now.
Yeah, so it is. It's a really exciting time for Versicode. And it's a really exciting time for healthcare as we've been going through this long, slow transition into value-based care, which has created a lot of opportunities.
Yeah,
Specifically at Versicode, we're partnering with accountable care organizations, IPAs, and any organizations that are working on risk-bearing contracts or any of the alternative payment models where they're bearing risk, where risk adjustment would be something that they'd be interested in. So as value-based care is progressing, historically, risk has only been borne by the high-level entities, by the federal government, by health plans, but value-based care is progressing, and that risk is being passed down to lower and
right.
lower levels in the hierarchy. So if you're looking at payment models that are out there, like the MSSP tracks, and some of the risk-bearing contracts that are even on the commercial level now. Medicaid has some risk-bearing in it as well. You can kind of foresee that the risk is being passed down, but that creates some
Yeah,
exciting opportunities for progressive and advanced organizations who really know their stuff when it comes to risk adjustment coding. So if I can just maybe back up a little bit and explain what risk adjustment is. So risk adjustment, I've always used the analogy is it's kind of like car insurance,
hmm,
but applied to healthcare. So it kind of makes sense. You understand that if someone is 18 years old, they've already been in a car accident, and they have 2 speeding tickets, they're probably going to pay more for health insurance than a 40-year-old with a clean driving record, right? And it just seems obvious. However, in
pay more
healthcare,
for car insurance than the other with a clean driving record. Yeah, absolutely.
exactly. So,
I know that one all too personally, Greg. I think I can say.
hey, yeah, we won't talk about my driving record. So, there's laws and there's regulations in place to prevent patients from being charged more or less for certain things. So instead of the patient being charged more for being young with a not clean driving record, so to speak, let's carry the analogy over to health.
Hmm.
The insurers or the organizations are compensated more for providing care or providing insurance to that more risky patient. Okay. So that's what risk adjustment is. It's modifying the benchmark, the standard by which the risk of that patient is measured.
Right.
And they do that with some demographic factors, age, gender, a couple other things, and with chronic conditions. So there's a couple different risk adjustment models. The biggest one out there is the CMS HCC model. And they'll basically add up all of the chronic conditions that the patient has to determine how risky the patient is, how likely they are to use healthcare resources, prescription drugs, imaging, doctor's visits, specialist visits, surgery, stuff like that. And they'll set the benchmark that this patient should cost this much to care for. Then when they pool all of those patients into a health plan or into an accountable care organization or something like that, those organizations are able to then provide care for those patients either under the benchmark or over the benchmark. And that's how they're achieving upside or downside risk. If it costs more than the benchmark, they're losing money. If the care they provide costs less than the benchmark, they're saving money and they get to keep that savings. So for those, so what that means is that setting that benchmark accurately is really, really super important
Right.
because it sets the the goal that you're shooting for when you're trying to provide care for less than the benchmark so you can pocket the savings. Okay. So for those progressive ACOs, IPAs that are looking to take on risk, whether it be upside risk or upside mixed with some downside risk, it really behooves them to key in on their risk adjustment policies, risk adjustment coding policies, and make sure that benchmark is really, really dialed in so that they can be reimbursed correctly. Otherwise, they're kind of running blind. They don't know what the benchmark is, or maybe the benchmark's not accurate. It might be too high, it might be too low. They're not going to be reimbursed the correct amount.
And from all our research and the things we've discussed, it seems like this space is one that's really categorized by, when you talk about the decision makers, the people responsible for managing this, you talk about the change of the risk, it's changing drastically. And for the people that are tasked with keeping up with this, when we talk about, how are we trying to position things and provide a service to these people, it's an area where these people are filled with, there's a lot of stress. Surveys say, surveys say that a lot of people that are decision makers in this space are struggling to have clarity and feel like they know there are a lot of holes to fill. They know there are things missing in their strategy. And you ask them, you pose the question, how comfortable are you with your strategy or your risk adjustment strategy? And it's not very, or it's, well, we could do better, but, or it's a lot of these things where it shows that there's a lack of clarity, a lack of being able to sleep at night, knowing that this has been done properly for the organization. So then the positioning of from what I understand, is it's really all about providing that visibility to those folks, and really a good strategy involves some tools as well as some understanding and some hand holding on how to look at this now in this new economy, especially. So I'd love to hear a little more about how you're approaching some people in a unique way, some of the partnerships being driven, and ways of helping out those people we mentioned that are needing to find clarity. What's Versicode doing specifically right now to address that?
Yeah, sure. So I want to talk about your sleep at night thing first, and then I'll go back to that.
Very technical term. It's a very technical term there. The sleep at night
how well
factor.
Do you sleep? The sleep at night factor.
Yeah, tell us about that.
Yeah, I'd imagine if you're a CFO of an ACO or a VP that has budget reporting responsibilities, and you're taking on risk contracts, but you don't really know what your benchmark is and what your RAF targets are and all of that, that can be a really scary thing, because you're kind of running blind if you think about it. You're being graded without really knowing what the grading scale looks like, and you're just hoping that you come in under the benchmark that you're saving money. So of course, nobody's going to want to advance in the MSSP tracks, right? Track 1 is just limited upside risk, no downside risk. And most organizations are staying there because they don't feel safe taking on downside risk, largely because they're running blind, but if you had the data and the information that you needed to feel really confident to run your calculations, then you would probably strongly consider advancing into track 1+ or 2 or 3, because the upside is much greater because there's downside present. So if you really get that benchmark dialed in and you're comfortable with it, you're going to be able to sleep at night better, because you're going to be able to take on more risk, but you're going to be able to do it more confidently, and there's going to be way more upside that comes with it. So that sleep at night factor is really key. It's funny, it's almost oxymoronic that you can take on more risk but sleep better at night. But that's because you're taking on more risk with that risk being managed and with more visibility and with more upside to compensate for it.
Could it be said, and I don't know if this would be a misnomer, but I think the layman's terms are, potentially having more risk, taking on more risk with a strategy isn't, not all risk is equal. So the ability to take on more risk is one part of it, but having the right strategy to capture and manage that risk, you could do quite well with. So that's a great point.
In investing terms, it would actually, you correct me if I'm wrong, it would actually be a lower delta, even though the risk band is wider, the delta is lower because it's actually less risky, even though the band is wider.
Right. So more specifically then, how Versicode's being really tooled right now to meet that need. You mentioned some really specific types of organizations.
Yeah.
Maybe just giving an overview of how some folks in each of those organizations, and you did trip to it a little bit earlier, but how some of the folks in those organizations can use Versicode, whether it's you mentioned a CFO, if it's someone, if it's a staffing team, if it's a freelancer who's trying to develop more expertise in the field for their client mix and be able to take on and manage or help more clients that need clarity. There's quite a variety of how Versicode can fit into that mix. You want to buzz through and give some, talk about some of those different people, the different potential users, and how they're using Versicode right now.
Yeah. So one of the reasons that organizations haven't been doing more on the risk adjustment front is that it's a massive undertaking. And really, to do a really good job of it, it requires you getting down to the level of an individual patient medical record and combing through that medical record to validate existing diagnoses and look for missed diagnoses, provide documentation for that, eliminate overcoding. And that happens on an individual medical record document level. And then you multiply that by however many patients are in the ACO, which I think the minimum is 5,000. And that's the minimum for an ACO. Many are many multiples larger than that. So it's a massive undertaking. And that's why it hasn't been happening, because it's just such a big project.
Right.
So that's where Versicode is coming in. These organizations have never really had to do that before. Risk adjustment historically has always been the domain of CMS and Medicare Advantage plans, and it hasn't been in the domain of ACOs and IPAs. But now it is, and it will be even more in the future. So it's a big undertaking, but that's where Versicode
it's not going anywhere.
Right. It's not, and it's coming even more, ready or not, like it or not, here it comes. So that's where Versicode is stepping in to help provide these organizations with tools and resources and services and support to help navigate that transition to value-based care, specifically in the risk adjustment arena. So Versicode can help your organization in a couple of different ways. It can help just as a platform if you're trying to get a risk adjustment program started, but you don't have a software platform to be doing any of that. We can help with consulting. If you aren't really sure how to get started, we're able to help with consulting and education to help you with some of the best practices. We have a lot of experience in the risk adjustment space and what works and what doesn't, and how to streamline processes within your organization to really get the most bang for your buck and get the most done with the least amount of work and do it efficiently. Or we can operate as a full service opportunity. So if you say, hey, we want the coding done for us, we want you to go into the medical record and deep dive for us, we also provide that service. So it's really customizable to your needs, what we offer. We're not coming into our interaction with you and saying, this is what we are, like it or not, work with us. We're saying, hey, what do you need? What do we have? How can we work together? Let's have a conversation, because we're really all on the same team, all trying to accomplish the same goals. So let's work together to that end.
I really like it, Greg. And I like that of all the different available tools right now or organizations in the space right now, I think it could be said that really Versicode is, if someone were to look to designate it as where it fits in the space, I'd say it's very flexible. It's one that's, like you mentioned, it's more flexible for a variety of types of users. And it's based on the premise that this is something that's changing more rapidly than ever. And the risk is being seen in different layers of the industry that it's never been seen before. So a whole lot of people that this wasn't on their list to have to take care of and be responsible for not that long ago, it now is. Which anytime that happens in an industry, in a space, there are a lot of opportunities for people to want to learn. And the consulting approach too, I think that layer of having it be a flexible service or tool, and then also having the consulting layer is key, because like we're all talking about, the change right now is just immense to keep up with for any organization, large or small. So Versicode's flexible, the consulting layer, it's set up to serve a really broad group of users in a variety of ways. So it's an exciting time. It's great to be in launch mode with this, and we'll definitely be sharing some more details about it. But Greg, anything else you want to just share real quick that could be helpful to someone looking at this maybe for the first time and trying to get some information?
Yeah, I think we'll probably have some more conversations like this and talk more specifically in detail about the features and the benefits of the Versicode tool in specific, instead of more in a general industry way. So look for those videos. Visit our website, www.versicode.com. That's VERSICODE.com. We have new blog posts coming up frequently with some information, and reach out and start a conversation. Look for us on LinkedIn. We'd love to chat with you and see how we could help, see how we could partner together.
Absolutely. That's a great overview, Greg, and we'll talk real soon. Thanks.
Great. Thanks, Nathan.